Good afternoon, everyone. Our daily briefings typically start with an update from Dr. Fizgerald. But there's something of great importance that I want to address first. So today is the National Day of Mourning, and that's a day that's held annually in our country on April the 28th. So this year's theme is Mourn the Dead and Fight for the Living. It is a day that's dedicated to remembering those who have lost their lives or those that have suffered injury or illness on the job because of a work-related tragedy. So I encourage everyone throughout our province to take a moment today to remember and honor those affected by a workplace tragedy. I also encourage everyone to renew their commitment to improving health and safety in the workplace and preventing workplace accidents. Last year, the lost time incidence rate due to workplace injury or illness in Newfoundland and Labrador was 1.6 per 100 workers. That's among the lowest in the country. Sadly, however, in 2019, there were 26 work-related fatalities. 10 of those were accidental and 16 from occupational diseases. Now, most of those were from exposures to dangerous substance years ago in the mining industry, and thankfully, through successive governments, we've been able to improve the workplaces and regulations in many of those industries. But we all know that even one fatality is one too many. It is a reminder that we need to make safety our focus every day. And today, as we navigate through COVID-19, many workplaces have done just that, as they've adjusted in order to operate safely within the public health guidelines. So I want to thank you for following the guidelines that we have put in place. It is, however, important to recognize that we all have a part to play. We must adjust our workplaces. We must continue to practice physical distancing and proper hygiene measures to protect ourselves and also to protect the essential workers and the services that they provide during this pandemic. We rely on those essential workers so we must need to let them know that they can rely on us. Now, usually on this day, it's the St. John's and District Labour Council that would hold a ceremony in the lobby of Confederation Building, and there we would lay wreaths and pay respect for workers who have lost their lives. Instead, given the current situation with COVID, many paid their respects to a virtual candlelight vigil at noon today. So as Premier of the province, I've been working closely in encouraging safe work environments and communities with our all-party committee. That's the opposition leader, Mr. Crosby, and leader of the third party, Ms. Coffin. So on behalf of all three political parties today and all our MHAs, I want to pass along my sincere thoughts to all the families and friends who have been affected by a devastating workplace tragedy. And we ask that you continue to do your part to protect those working the front lines to provide services and supports to our communities. Promoting safe and sustainable communities is a priority for our government, and we will continue to work with our partners because we want to make sure that as workers, when you leave to go to work every day, that you return, at the end of the day, you return home safely. That is our goal every day, and especially right now as we navigate our way through this virus. So right now we are going to take a moment of silence to remember those who have lost their lives or those that have suffered injury or illness because of a work-related tragedy. Thank you. I will now turn it over to Dr. Fizgerald.
Thank you, Premier. Good afternoon. Thank you for joining us today. I, too, would like to acknowledge today being the National Day of Mourning in Canada. This is an important day to remember workers who have lost their lives or who have suffered illness or injury as a result of workplace-related hazards. You are in my thoughts today. I'll begin now with an update on COVID-19 in our province. Since the media availability yesterday, we have had no new cases. The total number of cases in our province remains at 258. By region, we have 240 cases in Eastern, 8 in Central Health, 4 in Western Health, and 6 in Labrador-Grenville Health. 52% of cases are female and 48% are male. And by age, we have 22 people under the age of 20, 38 between 20 and 39, 38 between 40 and 49, 56 between 50 and 59, 57 between 60 and 69, and 47 people who are 70 and above. 4 people are in hospital due to the virus, and of these patients, 2 are in intensive care. 222 people have now recovered, and in total we have tested 7,955 people. As the first wave of COVID begins to subside in Newfoundland and Labrador, it no doubt leaves us with a hard-earned sense of relief. Our shared efforts and ability to contain this virus over the past number of weeks is extraordinary. Without your unrelenting dedication and support, this wave of COVID-19 would have most certainly resulted in higher rates of illness and more lives lost to this disease. For your unwavering strength and endurance during this most challenging time, I offer my sincere gratitude and appreciation. We know from our learnings and from that of others that COVID-19 will remain with us for a while, and our best protection is to continue to follow the public health measures in place to keep our loved ones and ourselves safe. While following these measures will not guarantee full prevention of COVID-19, they are by far our best defense. Please continue to act responsibly, wash your hands often, practice cough and sneeze etiquette, stay home in your bubble as much as possible, and especially if you feel unwell. Avoid public places and keep a safe physical distance of at least 2 arms lengths from others when you go out for essentials. As Dr. Rahman said yesterday, when the time comes, we will need to look for smart and creative solutions that will allow us to safely ease some of the public health measures we have put in place and resume a new way of life until a vaccine is available. This will be a slow, phased-in approach that will be closely monitored and adapted accordingly. We must strive to prevent risk and to mitigate effects, where possible, of subsequent waves of this virus. The health and safety of our people remains our highest priority. Today, I'm amending a previous special measures order that requires operators of personal care homes and long-term care facilities to prohibit staff from working across multiple locations, to also prevent staff from engaging in any other employment while simultaneously employed at a personal care home or long-term care facility. This amended order applies to all staff unless in exceptional circumstances and where an exemption is granted. For more information on this order, please visit gov.nl.ca/COVID-19. As this is National Medical Laboratory Week, I would like to recognize today the incredible professionals who work in our medical laboratories, many of whom have played a pivotal role in testing thousands of people for COVID-19 over the last month and a half. Your quick work, skills, and expertise allows us to confirm cases of the virus so we can immediately respond with contact tracing and to help contain the spread. You may not be the people who people see on the front lines of this pandemic, but your work is vital to our entire healthcare system. And I thank you for your invaluable contribution. I would also like to remind people that while physical attendance at medical appointments may be lower right now, a significant proportion of family physicians in our province are offering virtual alternatives at this time. It is important that you continue to follow up on your medical care, receive timely consultations, and continue treatment plans for existing conditions without interruption. The Newfoundland and Labrador College of Family Physicians have reached out to us to advise you that your family physician is readily available to assist you in this regard. So please do not delay seeking necessary care during this time. If you require non-urgent medical care from your physician, I encourage you to contact their office for an appointment. As a recap, for those who may have just joined us, we have no new cases since yesterday's media availability. The total number of cases in the province remains at 238, with 258, with 240 cases in Eastern Health, 8 in Central Health, 4 in Western Health, and 6 in Labrador-Grenville Health. We have made significant inroads in our fight against COVID-19, and in times to come, when we look back at this challenging and unprecedented time, we will do so knowing that in the face of adversity, we did not give up, but instead we gave it our all. And until then, when we find ourselves doubting how far we can go, let us all remember how far we have come. We can do this, and we will do this together. Thank you.
Thank you, Dr. Fizgerald. As we are dealing with COVID-19 pandemic, we are also watching very closely what's happening in Fort McMurray, Alberta. As you know, that we have many strong connections with Fort Mac. Many of our families and our friends either live there or commute there from work. So today we want to let them know during this recent flooding that we are indeed thinking about you. So 0 new cases today, and we certainly hope that this is a trend going forward. And we heard from Dr. Rahman, as Dr. Fizgerald said, and he alluded to yesterday, that we have done some very great work as a province as we continue to follow the guidelines to flatten the curve. Now, we sit here every day and we update you, we encourage you, and sometimes we even strongly remind you. But it's you who deserve the thank you today for the hard work. Our results are proof that physical distancing and practicing good, proper hygiene, well, it's working. So I would send you, I guess, a virtual I-5 as we congratulate you for your efforts, but as Dr. Rahman said yesterday, it's not a time to celebrate victory just yet. We do have a ways to go. We're not out of the woods and we're not into the clear, but and we know that this COVID virus lives amongst us. We must remain attentive as we move into the next phase of living with the virus in our communities, but doing so in the safest way possible. So what we're asking for is simple. Keep physical distancing yourself from others. Wear a mask or to keep the cough and the sneezes to yourself and to wash your hands. It is only by your actions that we will be able to make adjustments and start transitioning to what is a new normal. What this means is that your movements will be our guide. If you continue your efforts and guide us down the right road, then we can get a little more comfortable in guiding you through what will be that new normal. A new way of living to keep your health and safety at the forefront. Essentially, what we're talking about is an investment of time into your own health. But if we start to let up on the guidelines as we look forward to transitioning, well, what we know is that the process will be set back. So there is a consequence of not following the guidelines. We have to continue to work together as we are all working towards a common goal. Now, many of you continue to amaze me in your community spirit and your countless kind gestures for those in need and those of you that reached out in trying times, and you do so consistently. We've seen companies and organizations within our communities pull together to utilize their equipment and their skills to make personal protective equipment. We've seen organizations, and one example, and there are many examples. A few weeks ago, if you remember, we had truckers who were essential workers coming to our province delivering essential goods. And they found it difficult to find a good meal. And we had the Salvation Army in Port aux Basques that has stepped up, and to date they have provided over 700 dinners to those truckers on their arrival and departure from Newfoundland and Labrador. We've also seen groups like the Kids Eat Smart. They've been fundraising, providing emergency food hampers for children and to families. And we've seen individuals and neighbors, friends and families support each other and finding different ways to keep in touch and to socialize. And I know in my own district, I've seen people that have donated milk and vegetables on a routine basis, making sure that people had those little extra things when they need them. This is our Newfoundland and Labrador, and I'm beyond proud to stand alongside you. So let's continue to move forward together. I will now pass it over to the Minister for his comments.
Thank you very much, Premier. I too would just like to open my remarks just to mark a National Day of Mourning and remembrance for those who have died or were injured on the job. From my previous job, you recall patients, you recall incidents where people who have gone to work thinking it was a normal day and had their lives turned upside down, or who unfortunately never made it home. And we mark these days in our own way, and I think a moment of silence, such as we've just observed, is one of those ways when we can reflect and see what it is we can fire ourselves up to do a little better next time. From the point of view of the comments from Dr. Fizgerald, and indeed some data that was released from the Public Health Agency of Canada today, it is obvious that Newfoundland and Labrador has worked hard and finds itself in that group at the bottom of the graph where our curve is relatively flat and our numbers are good. And again, to echo my other panelists' comments, this is a testament to the hard work of everybody in this province. But as Dr. Rahman said yesterday, this is not going to be a short affair. This is maybe the end of the first wave, the first fire in potentially a series of fires. And we are in a phase where those embers still lie among us and glow, and it would be very easy to fan them back into clusters by getting a little bit too happy and a little bit too carefree with how we relax just at the moment. There is no vaccine yet for this virus. There is no specific treatment or cure yet for this virus. And those things are each anywhere from 18 to 24 months out on the timeline, even under ideal circumstances. So we have to rely on the mechanisms that have served us well now, which are the hard ones and which are the ones everybody would really like to kick over and get back to what we all regarded as normal before the end of February, for example. In helping people manage the stress that this has caused, we've emphasized our own tools that we've provided, and bridgethegap.ca has become a very well-visited place. The site has seen its traffic doubled. Today I'm going to add to their woes by announcing that there are now webinars on wellness that will be available for anybody who chooses to view these. They're on a variety of subjects. They talk on issues from anxiety to parenting, to how to talk to your children, to coping with the stresses that we find ourselves in. Given some of the comments that we've had and the difficulties we've had about end-of-life care and palliative care and the funeral constraints from the cluster and from other things, there is also a very timely one on grief and managing grief. For those of you for whom those webinars are not sufficient and the other tools are there, 811 can direct you to the nearest Doorways clinic, where for those who really find it struggling, there is no appointment counselling available. And I think that can help for those of you who have been in an unfortunate situation to have a loved one pass during the epidemic. As we prepare to look at our next steps, for example, I had a conversation today with the Mayor of St. John's around, the possibilities around the parks and things like this. One of the things that came out of it was certainly that preventative maintenance and looking after your assets as a municipality or as a business, as long as it can be done with physical distancing, is entirely appropriate and not specifically forbidden in terms of an order. So, for example, parks or campsites that require maintenance that's essential, that can be done as long as physical distancing is observed. So parks, golf courses, for example, and campgrounds, as long as the workforce that are involved there is behaving according to the principles that we all have to live by for the next little while. One of the interesting things about this panel is that sometimes we end up with questions and they generate a whole discussion, and I'm fascinated to watch the discussion in social media and in the mainstream media around the discussions yesterday on contact tracing. It's been really an informative exercise. Michael Harvey was on the radio today. The Newfoundland and Labrador Centre for Health Information have been back and two with us, and it's generated further excitement and further interest in this whole concept. So walking down that road, we're looking at a process that's totally transparent. We're looking at a model that is decentralized, or models that are decentralized. So the data is actually held on the individual's phone and only released with specific consent, regardless of the consent obtained when the app, for example, was installed. But with that, as the Privacy Commissioner said, the utility of a tool like this would be enormous in terms of benefits to personal and public health. And then we both agree that it needs to be done in a way that respects privacy. So those conversations will continue, and I know my department staff are speaking with him, if not today, then certainly in the next 36 hours. So from an intellectual point of view, I'd love to listen to these discussions go on further. But again, back to practicalities and the immediate short term. The end of the first phase is in sight, and the hardest thing now is going to be for everybody to continue to toe the line, as it were, to hold the line, and to keep us all safe. Because no matter what happens in terms of an adaptation plan or a return to work plan, we are going to need to live with the principles of social distancing, masks where not possible, and behaving differently in stores and public areas in a way that we haven't done. And we're going to need to do that for the next couple of years. So it's the bubble. Create your own bubble, protect it, and don't burst anybody else's. This is what is going to keep us going over this next 18-month to 2-year period. So with that, Premier, thank you, and I'll turn it back to you.
Thank you, Minister. We will now open it up for questions from the media.
Thank you, Premier. For the benefit of our speakers, we have 6 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. We will run through the telephone queue, and I will call on each reporter by name to ask questions. Please do not press *1 until your name has been called. Following this, should time permit, reporters will be individually asked for single questions. This call will end at 2:59 p.m. and further questions can be emailed. Our first questions today are from Peter Cowan of CBC News. Please go ahead.
Should you have a question, please press *1, Mr. Cowan. Once again, please press *1 if you have a question. There are no questions registered at this time.
We'll move on to Kelly Ann Roberts of NTV News. Please go ahead.
We've heard extensively that a plan is in the works. Government is working on one. We are waiting on modeling and data. We have that. Where is our plan? When are we going to see this? People are anxiously waiting to know if there's any form of normalcy to come.
So I think we leave those, we're working very closely with the Chief Medical Officer, and as you've seen across the country now, even today, the federal government, talking about what a reopening plan would look like. We've seen other provinces like Saskatchewan, and we've seen New Brunswick and Ontario, Quebec, and so on, PEI. So I think we will leave that news to the Chief Medical Officer. She wants to address that and, what the timeline would be like. I know she has a staff that's working, very hard on this plan. And right now I think it would be premature for me as a Premier. I default those decisions and, of course, those announcements to the Chief Medical Officer. And she can speak to that when she sees fit.
Dr. Fizgerald?
So, as Premier said, we are working very diligently, as I'm sure my tired eyes can tell you today. We have been working on this nonstop for the last several days. It's really important that we do it right. So, when we are ready, we will make that announcement, and it will be soon.
Can we get more of a time frame than soon? I mean, we're seeing other provinces releasing them. Quebec looking at opening schools, and their case rate is exponentially above ours.
Can I just chip in here, Kellyanne? I think, to be fair, whilst our curve is flat, the evolution of the disease in this province actually lags behind other jurisdictions. And I would echo what Dr. Tam, what the Prime Minister, and what we've said around the plan is, it is more important to get it right than get it quick. So if Dr. Fitzgerald's team can't give you a time, it's not because they're being evasive, it's simply because they can't give you a time. I am confident that we will have one in the very near future, whether that's 2 days or 4 days, none of us can say at the moment. When it's ready, it will be ready.
Okay, thank you.
That was you asked 3 questions. So we're going to go back now to Peter Cowan of CBC News. Please go ahead.
Like Ontario and Quebec, they're still seeing hundreds of cases a day, yet they've been able to unveil their reopening plan. Why are so many other provinces able to do it when we can't?
So you can unveil a plan, and we could be in a position to do that, and we'll do that, working with the Chief Medical Officer. But we also must be mindful that getting it right, as the Minister just said, is extremely important to us. We've learned a lot of lessons, in Newfoundland and Labrador about if we don't apply the proper discipline, we don't adhere to the guidelines properly, that as a province there is a level of exposure. And we've been very fortunate that, as an example, our long-term care homes, our personal care homes are, in those situations, some of the most vulnerable that we have in our society. We also know that we're kind of just a misstep away, and that could be us. And so we've done a good job. And so all we're asking for right now is a little patience. As the Chief Medical Officer has said, this is going to come soon. And when it comes, we think that we will have a very good plan, and one that will give us the best opportunity to continue on a path of success.
We've heard concerns from people in Bonavista, for example. They've said that tourists have come across on the ferry. They are showing up in the community. They're not isolating. They're hoping to go on iceberg tours. What does this say about the measures that we have in place, that some people are apparently able to just come into the province seemingly oblivious to the requirements that are in place?
One of the issues that we've had to deal with is that we have specified essential travel. We've specified that essential travel is the travel that we expect to take place, and non-essential travel should not. The ferry system between the main island and Labrador, and between the main island and places like Fogo or Bell Island, are under provincial control, and they have been very strict about that. Marine Atlantic works in a different way. Our assumption, and it's obvious that that assumption is flawed, has been that the only people who would be coming across on that ferry would be traveling for essential purposes. The attitude of the Medical Officer of Health has been quite clear, that anybody who came in from outside of the province was expected to isolate for 14 days, and as of very recently has actually been required to sign a declaration to that effect. It is obvious that people who have come in prior and possibly subsequent to that have chosen not to do that. That is an enforcement issue, and certainly that will be addressed. We are actually looking now in the department with Dr. Fitzgerald's team about what we should do to tighten up travel further. The irony of it is we've just had a series of very forceful questions asking us when we're going to return to normal and open up. And now, in a sense, we're probably going to end up writing potentially more restrictive orders just at the very time to do that. Having said that, from a scientific point of view and a medical point of view, strict border controls have been highlighted in every international jurisdiction as a way of controlling the potential flowering or spreading of this condition again. So all that needs to be put into the mix, and at some point in the very near future, we will be dealing with the issue of tourists from out of province.
Mr. Haggie, yesterday you talked about for the digital contact tracing app, you'd need about a 60% adoption rate. With some people having privacy concerns and may decide that they don't want to do it, would you look at providing incentives, for example, looser restrictions for people who do decide to use the app because there's a lower risk because they can be easily traced?
I would open to any suggestion that would encourage uptake of whatever app we end up promoting or using. The facts of the case are 60% is what the literature says in terms of a reasonable starting point for uptake. Other jurisdictions have made do with whatever they can get. And to a point, its utility increases exponentially with the size of the base that you have. But it is an adjunct to old-fashioned calling and visiting virtually contact tracing. So the win is to have it. The bigger win is to have it widely adopted. And whatever tools that we can use that are reasonable, ethical, legal, and satisfy the Privacy Commissioner, I'm quite happy to look at.
Thank you.
Our next questions are from Ben Murphy of VOCM News. Please go ahead.
Thank you. There's still yet to be anything announced for the tourism sector. Many are worrying as we're into May in just the next few days. Back to the mayor of Bonavista, he's spoken out saying they can't really even plan for anything at this time, and they're really just looking for some kind of clear message. What can you say to people in the tourism industry right now?
Yeah, the tourism industry and the accommodations, industry in Newfoundland and Labrador, this is one of the industries, that we all know just based on the calendar and based on where we are today and the guidelines that we put in place is an industry that we have to closely work with. And, we're putting together plans as we start to reopen the province, but also mindful that, when we get through this health crisis, we must have in place a good economic group of people like the tourism industry that are willing to respond to what the future of this province would look like. Tourism is critically important to the future of our province. We have a great market here that we attract, and I think in the future will be even more so. So we'll be working with the tourism industry. There are some federal programs in place right now, as as an example, those with rental deferrals and so on. But it's not enough to actually to secure the future of the tourism product in Newfoundland and Labrador. So we recognize this industry as one that we will have to pay attention to and put a focus on, and that's something you would expect from the province within the next few weeks.
And Premier, we still haven't seen a firm decision come out on what will happen with schools for the remainder of the year and if they could possibly reopen. I believe New Brunswick and Saskatchewan have outright closed them for the year with their reopening plans. Quebec's planning to reopen despite their large case numbers. But can we get a firm decision or are we close to a firm decision on schools for the remainder of the year?
Yeah, I think you're very close to that. I mean, as I said last week, it's very unlikely that under any scenario that we would get our schools back open this year. But we want to make sure that we get our plan out to the people of the province, and that we will explore those opportunities that we have. But it's, I think I can go as far to say that it's very unlikely that you will see in class with teachers and students, this year in our schools unless something unforeseen happens. But with that said, that doesn't necessarily mean that education stops. Right now we have teachers that are working closely with the students in both the Francophone and the English-speaking districts. Those teachers are providing some real good education to students, even at a different location from, as I said, from their dining rooms to their living rooms and from teachers at a remote location. So education continues. It's just a location now that we'll need to finalize.
And lastly, I just wanted to ask, I know you had that meeting, the Premier's meeting with Prime Minister Justin Trudeau. I was just wondering, what were some of the key components that were discussed in that meeting?
This was last Friday's meeting, you mean?
Yeah.
So the big focus of that meeting was one around the reopening of the economy and the national economy, therefore, and what role the federal government would play working with the provinces. So therefore, it's important that we have the federal government's voice in all of this, because if indeed we find provinces, that would have a setback from time to time, and, that could be us in Newfoundland and Labrador, it could be anywhere. So it's important that we continue to work together as all Canadians, and the Prime Minister and the Deputy Prime Minister, who was on the line, have agreed to do just that. So it's important, once again, to show Canadians, to give them the confidence that both the federal government and the provinces and the territories are all working closely together on their behalf.
Thank you.
Our next questions are from Elizabeth Whitten of All Newfoundland Labrador. Please go ahead.
It was mentioned in yesterday's briefing that the digital contact tracing app has been in the works for some time and it could launch soon. So I'm wondering, what type of information has the province already shared with Verifone?
The digital contact tracing project has actually been in existence for some time. There have been several threads. There's certainly been discussions with the federal government because they have an open source app. They have a commercial app available. We have had local companies who have been interested in partnering with us. Certainly, any information that's shared with any of those groups is done so on the basis of what we call information sharing agreements. These are common between government departments and private industry and are written to a standard that ensures the information in there is safeguarded in a way that satisfies both the law and the Privacy Commissioner. So I couldn't give you the details except to say the principles behind it are embedded in information sharing agreements, which are common between government and private industry standard.
I think it's fair to say, too, and I think we must remind the people of the province that, as the measures to reopen Newfoundland and Labrador, as that begins to unfold in the future, is that, we've had good contact tracing within the province. An example of that would have been around the cluster at the funeral home. So, this is a very nice to have, I think would be an important component of as we reopen the province, but yet we have a great group of people at the public health that has been doing a good job in contact tracing as well. So this would be nice to have for us in Newfoundland and Labrador. I think it would show some leadership in this nationally as well. But that's not to underestimate the great work that the public health officials has been doing in the past.
Yeah.
And I was curious because, we have such a low number of active cases. I think if my math is right, it's 36. So why introduce digital contact tracing if the gumshoe, feet on the ground, public health contact tracing has been working?
So what happens when it doesn't, in the sense that we end up with another wave? All the predictions across the globe have shown that this wave is just the beginning of a pandemic that will last 18 to 24 months. I think it would be very irresponsible for us not to consider the possibility that after 8 weeks, we're off the hook. So this is a perfect time now to fix your leaky roof before it starts raining again.
And as a follow-up, what can be done to, further ensure that this information will be, kept private during the pandemic, and could it be destroyed or stored after it's passed?
There are all sorts of things like that. My understanding with a decentralized model is that the data is actually on your own phone. You only release it if you are contacted and asked to do so. And it's all anonymized anyway, in the sense that it's all PIN numbers related to Bluetooth location things. So the safeguards are all there. And, if there is a suggestion from the Privacy Commissioner that this data should be destroyed after a period of time, that can be built in. The question is, what kind of period of time would you be looking at? My understanding is one version of this only looks at collecting data on a 14 or a 21-day cycle and then erasing it anyway. So all those things can be factored in, and whatever is sensible is something we'd look at.
Thank you.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
Hello?
Hello?
Peter?
Go
Hi.
ahead, Peter.
I know this has been asked a couple of times. With regards to a plan to open up, 2 to 4 weeks ago, you're saying that the province is lagging behind other provinces by about 2 or 4 weeks. And then our numbers over that length of time completely flattened. So why are we going by the assumption that our evolution is somehow going to mirror the other provinces?
That's a good question. Some of it, I think, is an abundance of caution and the precautionary principle. I think the fact is that you also have to look at the nimbleness of the 80 people in the province who are actually managing the nuts and bolts of pandemic and public health medicine at the moment. So they immediately switch from crisis management to crisis maintenance to planning for the next phase. And I think that requires a different mindset. So quite frankly, you've got to give people a little bit of a break at the weekend and allow them to be able to do things in a reasonable way, and in a way that allows for us to take a breath. The rush to get back from where we are now into something else is driven by perfectly valid reasons, but they are not purely health ones. Not to minimize them, but as I say, from a health perspective that underpins this, the principles and the framework have to be as good as we can reasonably make them. They have to be right, not quick, and they have to be good, but not necessarily perfect to the point of paralyzing it. We walk a balance. I think we're nearly there.
Okay. Labrador, there's a lot of paranoia in Labrador, understandably, because of things like TB that have broken out there. It's a vulnerable population, and they have very, very low levels of testing, like the single digits on some days. Is the health authority there ready and able to ramp up testing very quickly if there's any hint of an outbreak?
The testing issue for anywhere in the province is more governed by PPE and the capacity at the public health lab. The only difference between samples from Labrador versus samples from Gander is that you would actually have a longer travel time to get there. The capacity per capita in Labrador is as good as, I would argue, if not better than on the island. And if you look at their per capita testing, they're up there per 100,000. And their numbers are extremely good. We've had no suggestions from the data and no concerns from the staff at Labrador Grenfell that they have a challenge that they can't meet.
The minister is right, Peter. If you look at Labrador Grenfell, they are number 2 in the province when it comes to testing on a per $100,000 on a 100,000 per capita. So they're number 2 in the province, next to Eastern Elf, and we all know that in Eastern Elf this is where we had 93% of our positive tests. So the capacity is there, and of course you just look at the numbers, and you will tell that they're number 2 in the province on a per capita basis.
Okay, and I had one other question, and that is if there's a construction project going on at St. John's, foreign workers came in and within 2 days were already on the site, that would definitely be breaking the 14-day isolation rule of April 25th, would it not?
So anyone who's coming in a trade industry has an exemption. They have to isolate while they're not at work, but they do have an exemption for their working hours.
Oh, okay. Can I ask why that is? All right, it's sort of a follow-up.
Pardon me?
Can I ask why that is?
Well, that was the exemption that we gave, was that people coming in to do work on critical work on construction projects could have that exemption for the safety of the project and for people who are working on the project. You know, I'm not a construction expert, but there are things that have to happen to ensure that that the project is safe.
Okay, thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Situation with regarding tourists in Bonavista. Mr. Haggie, you said that Marine Atlantic works in a different way, but I'm just trying to understand why that would be. I mean, whether it's an airplane or whether it's a ferry, you would assume that all these people will be traveling for essential purposes. So why would the way that we treat them at the border, at the point of entry, differ?
The issue around what is essential has not been defined in an order, simply because of the complexity of doing that. It doesn't allow any flexibility, for example, for family members to come home for a bereavement, these kind of things, or for people to fly. It needs tightening up. I have no argument with that. We're working on it, and we're trying to come up with something that makes sense, yet isn't overly prohibitive. The assumption had been that people who were coming were actually going to play by the rules. The fact they haven't, or the allegations that they haven't, are the subject of reports to the appropriate law enforcement agencies, and that's an investigation enforcement piece. But it's obvious from posts and the like in the last 24, 36 hours that the requirements of the orders that exist already are not being followed. I think had those requirements been followed, then there is still an issue with people going round for non-essential travel. Looking for a boat at a wharf to take you out to an iceberg is not, in my view, essential.
Newfoundland and Labrador announced that there would be quarantine measures in place for travelers to the province on March 20th. If we're applying these controls at the border, using forms or having people declare symptoms in different ways in different parts, what's the point of all of these restrictions if they're not being applied uniformly across the province?
The issue that you refer to about quarantine was a different one taken under the jurisdiction, I think, of the Indigenous groups who, because of resource issues on the coast, decided that anybody who was returning to the coast from out of province or out of country, it would be safer to have them quarantine or isolate in a large centre such as Goose Bay or St. John's before travelling into a coastal community. I think their preference was that they were done in Goose Bay. That was done because of their concerns about areas under their jurisdiction which had challenges potentially if the virus got onto the coast. That's an additional layer. My understanding was that was done through the Indigenous groups.
Okay, and when we're talking about tourists coming to the province for what are obviously non-essential reasons, how much of this comes down to differences in messaging on different, portfolios? We have health officials saying, stay inside, limit your movements, and then on the other hand, still from government, when I'm talking about fishery or talking about tourism, it's, well, okay, we're going to put this off for a little while. We're watching the situation. It gives the impression that, unlike what health workers are saying, we're not necessarily in this for as long of a haul. Is it any wonder that there are people coming to this province who aren't aware of the severity of some of the restrictions for travelers?
There are layers of confusion here. I mean, if you are a dweller in the States, in certain parts of the States, you would think there was nothing going on. The challenge is that the adverts, for example, those award-winning tourism ads, were paid for and bought before Christmas. And they're aired because they're there. The confusion then is also compounded by the fact that if you look at our original orders based on evidence at the time around the early part of March are now significantly different than the orders that are currently in place. And indeed, travel orders were altered by the Medical Officer of Health as recently as the weekend. And given our discussions now about the confusion with tourism versus essential travel versus non-essential travel, that's obviously going to have to be clarified by a further revision of the order. The fact is, Marine Atlantic, being a Crown federal corporation, operates under those rules, and absent any direction for specific exclusions, lets people on the boat if they bought a ticket. The difference, for example, in New Brunswick, we've actually had people trying to get to Newfoundland and Labrador for perfectly legitimate reasons who, because they don't have a Newfoundland and Labrador driver's license, we've ended up with the MHA vouching for their residency requirement in the province. So Nova Scotia, on the other hand, doesn't have any restriction on anybody passing through the province, despite the fact they've closed their borders. So you can see those layers of confusion just heap one upon the other.
We now have time for some single questions, so if reporters could keep their preamble short, we'll try to get through to everybody. So we'll start with Peter Cowan at CBC News. Please go ahead.
Please press star one at this time, Mr. Cowan, if you have a question. Your line is open.
A question about the cases that we've seen over the last week or so. We saw in the modeling data yesterday that it was referred to them as being locally acquired but known source. Can you give us an idea of what were the sources of this transmission? Where and how is this virus being spread?
So the source was a previously known case that had been investigated, and the person was exposed to that previously known case. Obviously, I can't give any further detail than that.
Not even the type generally of like...
Our next question is from Kellyanne Roberts of NTV News. Please go ahead.
Clarify in your preamble, you referred to campgrounds and golf courses for maintenance. Can you clarify this? Some people now thinking that means that they might be opening.
No, that's not what I said, and I'm glad for the clarification if that's what people took away from it. No, the municipalities and businesses have assets that will be damaged irreparably whether or not they're opened. And I'm thinking some of the golf courses, they have greens covered in tarps. These need to be removed, otherwise the green will not be fit for anything whenever it's opened. The important thing there is that for them is essential maintenance, and to fulfill the requirements of any orders, the workers there have to observe the principles that are laid out in Dr. Fitzgerald's orders. So physical distancing wherever possible, non-surgical masks wherever not, and those kind of things. No more than so many people in a vehicle if they have to travel to work. So those were simply examples. The parks was comment from Mayor Breen because of the potential that they may be a good area for physically distant exercise if we ever get a spring and a summer. If you were going to move down the road of relaxing some of these restrictions, the solitary pursuits of the open air would be the safe place to start. So that's where some of those comments from. But I'm glad for the opportunity to clarify. Nothing has changed, and nothing will change until a plan is announced and the orders are changed. So this was simply to reflect questions I'd had about what was routine maintenance.
Our next question is from Ben Murphy of VOCM News. Please go ahead.
Thanks. I just wanted to go back to the tourists popping up in Bonavista. Is there any concern about where these people are staying while they're coming here and visiting the province leisurely?
Well, yes. I mean, the understanding under which these people were admitted was that they understood there was a pandemic on the go, that they were going to self-isolate for 14 days, and then thereafter they would keep their travel to essential minimum. It is obvious that either what they said at the border or the point of entry and what they proposed to do differ somewhat.
Our next question is from Elizabeth Whitten of All Newfoundland Labrador. Please go ahead.
Just to go back to the app, I'm wondering what type of financial investment is being made into the app, or is it being done pro bono by that third party?
As far as financial commitments are concerned, I'm not aware this government or my department has made any in regard to any of these apps, be they federal, national, or local.
Thank you.
Our next question is from Peter Jackson of The Telegram. Please go ahead.
Hi. I'm going through the April 24th and 5th amendments, which made it sound like foreign workers were going to be ordered to isolate, and it seems that there is a rather glaring exception to that. how many foreign workers do we know that are coming in and actually going to work sites almost immediately?
So through the temporary foreign workers program, all provinces would be in a position, if they so needed, to bring in foreign workers. And some of those, we typically think of those, people that would work in processing plants or could work in, on farms and so on. But many of those are actually skilled workers that would be required and could not provide those, could not find those services, within the province. It could be even within our healthcare system. It could be in, some of the industries that provide employment. So to support those areas. But right now, as we all know, that there's a considerable number of people in the province that are looking for work. So, the message is today, as it was in the past, that if you can find someone local to do it, well, that is what we're saying to businesses or those that would hire people to. If you can find it locally, well, we'll make that get that service locally. So, there is an isolation plan that's in place, and there's that the federal government has put in place to work with those industries that require the workforce, the international workforce, to come into Newfoundland and Labrador.
Our next question is from Patrick Butler of Radio Canada. Please go ahead.
I want to ask one last question about tourists. Okay, given you're saying there's lots of different messaging out there, what's your message for tourists either in the province or considering coming to Newfoundland over the next, number of months?
I think for the moment, given the fact there's a pandemic, if you come from away, you best stay away.
Thank you very much for tuning in. The time for questions has ended. Please join us again tomorrow at 2 p.m. Newfoundland time, 1:30 in most of Labrador. Have a great evening.
Thank you.